the Journal of Child Psychology and Psychiatry, celebrating 60 years of empirical research, clinical studies, and systematic reviews. For details of our 60th anniversary celebrations, visit www.acamh.org/JCPP60. Follow us on Twitter with the handle @thejcpp and use the hashtag JCPP60.
Wow, I have to say, follow those 3 talks. I work on reading and language. These are cognitive skills that are normally distributed in the population, so why have I been invited? Well, I think it's because of the disorders of reading and language disorder, or DLD as we now call it, and dyslexia. And I think the importance of these disorders for clinicians is that they are very common. They affect learning and educational attainment. They lead to low self-esteem, and often poor mental health outcomes are associated with them. Now, DSM-5, to my mind, unhelpfully separates language disorder from dyslexia. Language disorder is classified as a communication disorder affecting receptive and expressive language, and dyslexia is classified as a specific learning disorder which affects the development of fluent reading and spelling, that is, decoding. Researchers have built on that, and I think colluded, to say that dyslexia is associated with phonological deficits, whereas developmental language disorder is more commonly associated with reading comprehension impairments. So why have researchers ended up colluding that these are 2 separate disorders? I think that's because they've strictly adhered to discrepancy definitions of disorder. So they've recruited to their clinical samples children who have normal or above average IQ with a reading or language impairment, so they're studying very pure disorders. And they've also tended to do many case control cross-sectional studies, and that still goes on. I think a major issue for our field is to understand how we can meaningfully describe disorders that affect learning in this way on what are essentially dimensions. And it's really crucial that we continue to try to understand this relationship. Now, of course, language and reading are complex systems with subsystems that can dissociate, but also they share variance. Recent longitudinal studies suggest that, contrary to the prevailing view that phonological skills are the predictors of individual differences in learning to read, actually language is the foundation of learning to read. Illustrated in this schematic are data from a longitudinal study that we've done. There are others which show that language at the age of 3 predicts at the age of around 5 what is now generally regarded as the triple foundation, which is a universal foundation for learning to read across cultures, comprising letter-sound knowledge, phoneme awareness, and also tapping rapid naming skill. And that following that triple foundation, phoneme awareness and letter-sound knowledge predict individual differences in the ability to decode as measured by reading accuracy. The predictors of reading comprehension are reading accuracy together with language. And in our data, we show that language measured at age 3 has a long-range effect on reading comprehension outcomes at the age of 8. We can also use this kind of model to start to try and understand the risks of reading impairment. And clearly, what this model shows is that language is a major risk factor for poor reading. But there could be other specific risk factors as well. And at the age of around 5, when the phonological demands of learning to read are coming to play, this is a point in development when more specific deficits in phonological processing would be expected to impact the process. And in my view, that is still the most obvious candidate endophenotype for dyslexia. After that stage, what we require children to be able to do to read fluently is to practice reading. So now print exposure, how many books in the environment come in all together to predict how well a reader we are. So this kind of model can help us to identify risk factors for poor literacy, and what it shows is that language has both a direct and an indirect mediated effect on reading comprehension outcomes. And of course we know by now that developmental disorders are the outcome of multiple risk factors. But I think there's some complicated issues here, because we also know from longitudinal studies that there's considerable stability in the development of reading and in the development of language. And what that really means is that individual differences in these skills don't change very much over time. In fact, the only instability is at the beginnings of learning in both of these domains. So we have a relatively small window for interventions. I also think we need to be mindful of the fact that our current models of learning to read don't necessarily include what you might call third factors. One that I've become particularly interested in is executive function, because in much of the research that we've done, we find that executive function is a very strong correlate of performance on many reading-related tasks. But when you pit it against language, which it co-varies with very strongly, in a longitudinal model, executive function drops out so that it's not considered a predictor, and then in terms of how people move from that kind of theory to practice, they don't think about the role of skills like executive attention, which surely must impact the process of learning. Similarly, there's as yet no such models that look at factors beyond cognition, and yet clinically we know that personality and temperament are very important factors in determining how well a child will learn, and I would also say in how well a child copes with something like a reading or language impairment. So I think a challenge is to ensure that this kind of policy-making statement, which I'm not going to quote who said this, should not be allowed. So policymakers often believe that the route to good reading is teaching phonics, and they actually think there's nothing we can do about anything else. I think this kind of statement should be eradicated, and that's one of the major challenges that we have. We need to develop more comprehensive models of the relationships between language and reading, and then convince policymakers of their importance. I also think we need to think in the domain of reading and language a little bit more about how we think about risk. It's undoubtedly the case that studies of children who are at family risk of dyslexia because they have a first-degree affected relative have been very instrumental in developing our understanding of the language deficits that accompany or predispose children to dyslexia. But in these studies, people only ever measure the reading of the affected relative. They don't go beyond reading typically to measure language or executive function, attention, and of course, so we don't really know what other heritable risks are in play, determining or increasing the risk of some kind of longer-term language learning impairment. It's also commonly believed, especially in educational circles, that environmental factors are important, and two that have been particularly of interest to policymakers and indeed researchers are the home literacy environment, and also the extent to which individuals themselves read or print exposure, the amount of reading for pleasure that a child does outside of school. But we now know that really these aspects of environment, which have very powerful effects on individual differences in learning to read, are really examples of genes acting through the environment. And that's really important because there is an increasing tendency for people to think they can fix these disorders just by changing the environment. And so charities, for instance, many charities are involved in giving books to children in less advantaged families to try and help those children learn to read. And I find it very distressing, and often will tell these charities, you know, what are you telling the parents to do? Because actually they think the provision of books is the question, is the issue, and it really isn't. So clearly we just need to continue to develop our understanding of what it means to be at risk of a reading and language disorder, and that is a prerequisite for developing theoretically sound interventions. But this is not meant to be a counsel of despair, because it's becoming increasingly clear that good interventions can be developed based on theories of the relationship between reading and language, and those interventions can be effective. In a program of research which our group has done using randomized control trials, we've shown positive effects of interventions delivered by trained practitioners working with parents in the early years, working with early years teachers. We've also shown powerful effects on the ways of teaching decoding by teaching assistants, and also language interventions to promote reading comprehension. None of these interventions have been very long. We've mainly got funding for 20 weeks, but the effect sizes are very credible, from 0.3 at the low end to over 1. And we strongly believe that sustained interventions would have much greater benefits. Of course, there are issues when you come to fidelity of delivery if you want to scale these interventions up. And in the UK, in the work that we've done with third-party providers, looking at our interventions produce smaller effect sizes, but nonetheless, again, they're not being sustained. The problems and the obstacles when we've tried to use these interventions in developing countries are even greater. So in terms of a future challenge, I think there are incredible challenges around implementation and scale-up, and also we need to know much more about how we help children who are resistant to intervention. So, can we meet this challenge? Well, I've learned this phrase, theory of change, which is what policymakers like to have. It seems to me that we have a number of challenges which are still, many of them are still fairly low level. We still need to increase public awareness of reading and language disorders. And in a consensus study led by Dorothy Bishop and published in JCPP a couple of years ago now, we used a method to gain consensus about the nature and terminology of developmental language disorder, and that work has been hugely influential, I think certainly in Europe and in English-speaking countries. For dyslexia, I'm afraid we still have to do work to dispel the myth. The myth has re-emerged. The myth is that dyslexia doesn't exist. Those of you who work with it will know that it does exist, and it can be very debilitating. For policymakers, we need to convince them that language is a foundation for education and that we need sustained approaches, so there are no quick fixes. Professionals and parents, as ever, need more information and support. And for researchers, I think the research agenda is actually open. I've not mentioned brains or genes. I've not mentioned polygenic scores. I think there are critical phases that we need to think about. I know it's an unfashionable concept, but if there are small windows in which we can intervene, we need to know what those windows are. And I think we need to be doing more robust trials to validate our causal models of what works. So thank you very much.
To be part of the advancement of child and adolescent mental health, visit www.acamh.org.